Hi, I'm Fatima Rodriguez. I'm the Vice Chair of Clinical Research, a cardiologist, and a researcher here at Stanford. If you want to walk with me, I'm just going to grab a cup of coffee. Maybe tea, let's say.
How would you explain what you do to your kids?
I tell them that I am a heart doctor and I spend a lot of time trying to find ways to prevent heart disease before it happens.
What inspired you to pursue this field?
My mom had heart disease early and technology saved her life. So I was always convinced that I wanted to be a cardiologist. I think the interest in research started a little bit later because as a doctor you treat one patient at a time, but as a researcher you really have the chance to treat populations. I'm just going to check in really quickly with my research team, make sure they're working. Hey guys!
What's the broad impact of your research?
My research is really focused on using technology, using data to prevent heart disease, which is a condition that is actually largely preventable by early identification of those at risk and promptly beginning preventive therapies.
What's a small daily habit that keeps you grounded?
I love exercise. I'm a preventive cardiologist, but I try to exercise every single day, and I find that that's kind of therapy for me, time to self-care and to practice what I preach to my patients.
You ready for some easy ones? Early bird or night owl?
Early bird.
Sweet or savory?
Sweet.
Mountains or beach?
Beach.
Favorite thing to cook?
I don't cook that much.
Go-to comfort meal?
Pasta.
What's your walk-up song or theme song for your life?
Reggaeton.
Favorite snack?
Candy.
What was your first job?
I worked as a medical interpreter.
First thing you do when you wake up in the morning?
I usually have 3 children on me, or at least 2 children on me, so I have extreme gratitude that I get this chance to be with them.
Why does research like yours matter right now?
There's no doubt that I'm focusing on a big problem. It's a common disease, and it matters because right now we have the tools to prevent, again, almost at least 80% of heart disease cases, but no one's doing them. And really it's that last mile from discovery to implementation that needs to be completed.
What are you most excited about in your field?
There's such rapidly evolving technology. There's AI and how we're able to integrate data to really personalize decisions for a patient. But I'll say I'm most excited about how we can democratize all that innovation and technology to reach the most lives.